Welcome back to the Rebel Core Content Podcast. Core content for anyone, anywhere, and just in time. This is Swami, and this week we're going to get into some of the common infections we see in pregnancy. We got 4 or 5 topics to cover, starting with urinary tract infection, which is the most common infection we are going to see during pregnancy. The vast majority of these are uncomplicated UTIs. The symptoms are going to be the same as you would see with a non-pregnant patient. And if it's a simple cystitis, you can treat the patient with nitrofurantoin or cephalexin. But if the patient has signs of pyelo, fever, nausea, back pain, you're actually going to want to be a little bit more aggressive, and the vast majority of these patients should be admitted for intravenous antibiotics and further monitoring. This is a bit different than what we see with most young women with pyelo, where if you can control the pain and control the nausea, you can send them home with oral antibiotics. In pregnancy, it's a high-risk situation, so we're going to treat most of these patients with intravenous antibiotics and admission. Let's move on from UTI to chorioamnionitis. This is an intraamniotic infection that is typically bacterial in nature and involves the fetal amnion or chorion membranes. This can occur in up to 10% of all pregnancies, though it is fairly less common in developed countries with good prenatal care. The rate of chorioamnionitis is significantly increased in patients with preterm labor. This diagnosis is going to be made based on maternal fever plus at least 2 of the following: either maternal tachycardia over 100 beats per minute, fetal tachycardia over 160 beats per minute, purulent or foul-smelling amniotic fluid or vaginal discharge, uterine tenderness, and maternal leukocytosis. Many of those signs and symptoms are fairly non-specific, but we want to cast a broad net. We don't want to miss patients with chorioamnionitis, which is why we're going to have a higher sensitivity and allow for that lower specificity. In addition to your typical labs like a CBC and blood cultures, you're also going to want to get a sample of vaginal fluid, cervical and vaginal cultures, and make sure to get an ultrasonography looking for fetal well-being. A digital cervical exam should be avoided, and if you're going to perform a speculum exam, it should be done with a sterile speculum, so best sterile conditions you can provide. Because of the risk here, both for maternal sepsis as well as neonatal sepsis, patients should be admitted for IV antibiotics and continued supportive care and close monitoring for possible early delivery. The antibiotics that you typically want to start here are going to cover polymicrobial bacteria. So something like ampicillin and gentamicin is a typical regimen that we see. Chorioamnionitis obviously is going to happen before delivery. One of the ones that we have to be looking for after delivery is postpartum endometritis. This is one of the most common causes of maternal deaths worldwide, and we need to be very closely looking for this diagnosis. The classic triad includes fever, lower abdominal pain or uterine tenderness, and foul-smelling lochia, but if you have any 2 of those, you should be very suspicious of endometritis. Once again, these patients need to be admitted to the hospital, covered broadly for polymicrobial infections, including anaerobes. Something like clindamycin and gentamicin is a typical regimen, or maybe pip/tazo. Finally, that brings us to septic abortion. The WHO estimates that 1 in 8 pregnancy-related deaths worldwide are attributable to unsafe abortion procedures. In the United States, this used to be much more common before Roe v. Wade. It became markedly less common in the period of time after that, but we might be seeing a resurgence of this now that laws have been changing. The clinical presentation is going to be very similar to endometritis: fever, abdominal pain or uterine tenderness, and this is all going to be in the setting of a recent abortion. In addition to the typical labs that you're going to get in patients with sepsis, you're also going to want to get coagulation panel looking for DIC. And then some imaging is actually going to be really important here. An abdominal x-ray looking for the presence of free air or retained surgical foreign bodies is important. And a pelvic ultrasound can be useful looking for retained products of conception or surgical foreign bodies. Broad spectrum antibiotics are once again going to be indicated. The typical regimen that we talked about in the past was ampicillin plus gentamicin plus clindamycin, making sure to cover for those anaerobes. But again, you could probably substitute something like pip/tazo and then broaden that with clindamycin or metronidazole if you thought that increased coverage of anaerobes was important. Make sure to update the patient's tetanus vaccination status, and most of these patients are going to have retained products and are going to need a DNC, so make sure to get your GYN colleagues involved. That is our quick overview of some of the common infections we see in pregnancy. And one of the big take-home points, or maybe the biggest take-home point to remember, is that in these patients, even if they look fairly well, most of them should be admitted for intravenous antibiotics and close monitoring on a GYN service to make sure they don't get sicker, because there really is a potential for that to happen. That's all for the Rebel Core Content Podcast this week. We'll be back in 2 weeks, another cast. In the meantime, don't forget to pop on over to the site, check out all of the fantastic posts from our faculty. And until next time, stay safe.